Hi everyone, this is Sean with the MassSupport Network here with your COVID-19 update for Friday, February 26th, 2021. So cases do have continued to decline since last week, but we do look like we are entering a bit of a plateau here. Worldwide, we saw 2.7 million new cases, which is about 200,000 fewer than the week before. In the US, we saw just under 500,000. Which is about maybe 100,000 less than the week before. And here in Massachusetts, we saw 12,000, which is perhaps 3,000 or so below where we were before. In terms of deaths, those are continuing to decline, as those do tend to follow a little after cases. Worldwide, we saw about 66,000 new deaths last week, which is down about 14,000. Though here in the United States, it was more or less level with about 15,000 new deaths. And here in Massachusetts, we lost 292 people to COVID-19 in the last week. So as we look at the trends here, testing is coming back up, which might account for some of the apparent upturn in cases, just as we're catching more than we were before with the downturn in testing that has been going on for about a month now. As you can see here, there is either a plateau or maybe even a slight uptick there. There's a lot of ways you could speculate about that, whether it's testing, whether it's variants, whether it's just we've kind of hit the low-hanging fruit here of case reduction, and now things are leveling off for a while. But we are, as you can see, definitely below or at the level of the summer peak, which from the perspective of early January is great. From the perspective of July is not very good. But if you look at the different regions, one of the other possibilities for the uptick could also be storm delays from south, especially Texas. Can be giving that uptick there, where there was kind of a loss of data for a couple of days. It is worth noting that the other regions are kind of leveling a bit though as well, and it's possible we're just kind of reaching the point where the easy stuff is done, and now it's going to be a bit more slow to reduce case counts. When it comes to hospitalizations, though, we are also below the point of the summer surge, which again is very good to have that reduced, and not a great number in hospitals. But of course, the summer surge was more focused in specific areas, while this last one has been across the entire country. So it is probably a greater reduction in any given area. So you'd see that the number of new cases, new hospitalizations per day has gone down, with December averaging 892 additional cases per day, additional hospitalizations per day, but then that reversed almost completely in January, and then it's gotten even lower in February. I would note, though, it does appear that we are kind of getting steadily lower reductions as we go on, with a bunch here in late January, then a significant number here in early February, and just kind of a little bit less as we go along. And that may just be just looking at the data from the more recent times, we're going to have less, a little bit less recorded there. But it's worth noting that hospitalization rates are going to be falling, but perhaps not as falling as quickly. As you can see, when we break it down by region over the last 2 months, there is a sharper decline in late January, early February, and then things do kind of level off for the last couple of days in many areas, which is something else to be aware of there. In terms of deaths, there was deaths continue to decline. There was a significant drop off, followed by a little bit of a spike there. That is probably a data artifact. Most regions are continuing to decline in terms of number of deaths. There was an uptick in the southern region that was largely due to a large number of backlog deaths from Virginia. Backlogs like that, of course, mean that the current rate of deaths has not changed, but just means that a couple weeks ago things were much worse than we were even aware. So let's move on to developments. A lot of things to cover here. First up, Massachusetts is beginning to reopen with a lot of businesses, including such essentials as cinemas and laser tag facilities, able to open to a percentage of capacity starting in next week. There is a lot of back and forth on this, whether this is time, case counts diminishing and vaccines ramping up, or whether this is a little too soon. We might see a repeat of the summer surges as a result of reopening too quickly. So there's still a lot of debate there, and where schools, of course, factor into all of that. Second is that the Johnson & Johnson vaccine has been recommended by the FDA panel, and a emergency use authorization vote is expected this weekend that is likely to go through. That will be a third vaccine we have available here, with the important factors that it is only a single dose vaccine, which makes just the logistics of getting vaccinated a whole bunch easier. There have not been any reported allergic reactions, which also makes things easier because there's not that waiting period. People can just go through a vaccine site, get their shot, and be on their way without having to wait or schedule a second appointment. And it's a lot more shelf stable. That said, there is not going to be a lot of this vaccine around for a while. Johnson & Johnson has been struggling to meet their totals, and we shouldn't expect more than a couple million doses in the United States until April. After that, though, they do plan to ramp up significantly, and we may see that be a significant factor in vaccinations going a lot faster for the summer, which would be especially useful then because that's when the general public is going to be eligible for getting vaccinations, and we should be doing millions per day. On other good news for the vaccine front, Pfizer has determined that their vaccine can be stored in regular freezers for several days rather than the super cold ones. This is very important for smaller, more rural hospitals and health centers to be able to distribute the Pfizer vaccine and just expand the reach of the vaccines we currently have. Also, Moderna is currently testing a booster shot for the variants, especially the South African B1351 variant. There's a couple of strategies for how that is going to work. Whether it is a third dose that's given after your 2 first doses of Moderna, whether that's bundled with one of the other doses or replaces one of them. There's a couple of ways that could work, but it is encouraging that we can get these boosters made quicker than variants can emerge. There are a lot of variants out there right now, even a couple more from New York and California, though it's hard to tell which variants are significant and which ones are just going to be a local flavor, as it were. The next couple months are going to be kind of a race between vaccines and variants to see which way the pandemic is going to go, and having booster shots should push things much more firmly into the vaccine camp. And you can find our sources at the COVID Tracking Project, New York Times, mass.gov, and of course the CDC. And for more from the MassSupport Network, you can find us on our website or on social media. And remember, wear your mask, wash your hands, and we'll be here if you need us. Stay safe.